Hi, my name is Darla Hughes. I'm an FNP student at United States University. I am here to discuss a patient in our class FNP 596 for our clinical discussion for week 4. Today I'm bringing to you a patient that I had in the clinic this week. Initials are PH. She's a 71-year-old female born on March 30th, 1954. She arrived to the clinic with her husband on March 31st. Our initial PH, she comes to the clinic for a cough that has been lingering for the past 2.5 weeks. Along with this, she's had fatigue, fevers off and on, and some shortness of breath. The patient brought her to the office for evaluation, but our patient was a good historian all by herself. Her chief complaint was that she had been very fatigued and her cough will not go away. Her HPI, she's a 71-year-old female. She's been married to her husband for the past 48 years. She's retired. And again, she comes to the clinic for the cough that she's had for the past 2.5 weeks, off and on fevers, fatigue, shortness of breath. She reports that her cough is productive. It's thick, yellow, sputum. She states that she's been taking cough syrup at home, but it only helps for a little bit. Her past medical history is that she is an everyday smoker. She says that she smokes about a half a pack of cigarettes a day. She does have hypertension and it has obesity. She doesn't have any surgical history or hospitalizations. She doesn't have any known drug allergies, food allergies, or seasonal allergies. Medications, she takes Tylenol 500 milligrams every 4 hours as needed for fever and pain. For her hypertension, she takes metoprolol 25 milligrams and lisinopril 40 milligrams. For vaccinations, she's had all of her childhood vaccinations. She recently, 2 months ago, had her pneumonia vaccination plus her shingles vaccination. She's had the flu shot this season, and she did not receive any of the COVID vaccinations or boosters. I did ask her family history, but none of it was notable. No significant family history. Her chemical history, she did, like I said, she does smoke a half a pack of cigarettes a day. She denies any alcohol use or illicit drugs. She has a regular diet. She does not exercise, and she does have about 2 to 3 cups of caffeine a day. For her ROS, she reports the fatigue, occasional fever, shortness of breath, and productive cough. Her eyes, no drainage, no pain. Ears, nose, throat, mouth, no changes in hearing, no pain, no draining. For her cardiovascular, like I said, she shortness of breath, history of hypertension, but she denies any palpitations or chest pain. Pulmonary, she reports the productive cough with the thick yellow sputum, a little bit of wheezing. She hears shortness of breath, mostly on exertion, but even when talking to her, you can tell that she's short of breath. She neurologically, she's denies any headache, nausea, vomiting. There's no swollen lymph nodes. Skin-wise, there's no rashes, no wounds. And then endocrine, no heat or cold intolerances. Her vitals in the office that day, her temperature was high. It was 101.3. Her pulse was 87. Respiration 17. Blood pressure was 138 over 40 over 76. Her O2 sats were in the 90s, 90% on room air. Her height, she's 5'3", 256 pounds, which puts her at a higher BMI of 45.3. So for her physical assessment, generally she's alert and oriented. She appears well nourished, even though she's not feeling well. For her HEENT, Perla is intact. Her EOMs are intact. No abnormalities noted. Her sinuses are non-tender. No facial drooping. There's her nasal mucosa is pink and moist. I did notice a deviated septum. Her neck is non-tender to the cervical area, no lymph nodes palpable. Neuro, she's alert and orientated. She's appropriate for her age. Cardio, I didn't hear any murmurs. S1, S2 was heard, no jugular vein distension. Noted no edema. Her peripheral pulses were brisk at 2+. Her lungs, dyspnea on exertion, even with talking to me. No cyanosis was noted. Accessory muscles were noted when she was trying to breathe. No tenderness, though. No masses seen or felt. Lung sounds were coarse with wheezing throughout all fields. GI, normal bowel sounds noted. Skin was normal. No cyanosis or lesions noted. So my primary diagnosis is bacterial pneumonia. My differential diagnosis are bacterial pneumonia, ruled in due to the duration of the illness, the fever, the shortness of breath, cough, fatigue. Numerous bacteria can be caused bacterial pneumonia, which is characterized of inflammation of the alveolar gaps in the lung. So this would be my primary diagnosis. Another differential diagnosis would just be the common cold, but with this one, it is ruled out because she's not having any like sneezing, sore throat, watery eyes, or inflamed eyes. And number 3 for your differential diagnosis would be sinusitis. I ruled that out because of lack of nasal congestion, loss of smell, headache, or facial pain. My plan with our patient, PH, would be to send her for a chest x-ray, CBC, BMP culture, sputum culture, BUN test, and a rapid viral test that we did in the office, which was negative. My therapeutic plan with meds would be azithromycin 500 milligrams. I would do the Z-Pak, which is 500 milligrams on day 1, and then on days 2 through 5, I would do 250 milligram once a day for the remaining. And then I would also give her, or suggest for her to have Tylenol, 500 milligrams every 4 to 6 hours for fevers. And then my referrals would be to inform the patient to seek emergency care if there's any trouble breathing, if the skin, if she's noticing any like skin blue tone to her skin, her fingers, or if her fever is consistent, like above over like 102. That's not being subsided by any medication. Education and follow-up for my patient would be to, number 1, try to encourage her to stop smoking, as well as be around secondhand smoke. Encourage plenty of rest and water, teach proper hand hygiene, and to finish the course of antibiotics, like even if she starts to feel better, because she can develop a resistance to it. And then I would do a follow-up appointment in 2 weeks, and then possibly a follow-up chest x-ray in 4 to 6 weeks for her. And then if she has any worsening symptoms, to call the office for an appointment for care.